Social media. There's so little research, yet so many blame its use for many of the current generation's way of life. And more recently, in a series making global impact, we're faced with answering questions regarding the era of youth development and social media. The Netflix series Adolescence sparked discussion across social media, inside family homes, and even in Parliament, with scenes showcasing youth, bullying, mental health struggles, and the pressures of social media. The show reopened a difficult but necessary conversation. Are young people more violent, more anxious, or just more visible than ever before? Dr. Alexandra Gold is a licensed clinical psychologist and member of the faculty at Harvard Medical School and Massachusetts General Hospital, working closely in bipolar treatment innovation. She says that despite the need for it, the research to prove that social media is a cause for anxiety is just not there, but links are visible.
And researchers are debating about this literally right now. What is the relationship between social media and youth mental health? We know that youth are struggling with their mental health. In terms of whether social media is causing that, we do see association. We see linkage between higher symptoms of depression, higher symptoms of anxiety, and what we might call problematic smartphone use across different studies. So this idea of using smartphones in a way that's kind of almost addictive, spending a lot of time on smartphones, feeling like one can't stay away from their cell phone, and then having more rates of depression and anxiety. In some studies, it was 3 times as much depression, twice as much anxiety compared to those youth who were not using their smartphones in problematic ways. But to say that social media is causing that, I don't think the research is there yet.
In his book, The Anxious Generation, Social Psychologist, Jonathan Haidt identifies the rise of smartphones and a spike in anxiety, depression, and even suicide among teens. He cites troubling data that suggests a global mental health crisis is unfolding in plain sight, beginning his book with an analogy of, would you send your child to Mars with no data or research? Well, that is essentially what we're doing, handing over smartphones to children with no data or research of what these devices are doing to them or to us. In a passage from his book, it reads, "My focus is on why rates of mental illness went up in so many countries between 2010 and 2015 for Gen Z, while older generations were much less affected. Why was there a synchronized international increase in rates of adolescent anxiety and depression?" And for those who may think that their child won't go out looking for violent content or even content that would make them feel uneasy, Dr. Gold says sometimes it's not even their choice. She brings to light the uncertainty of the algorithms and how they haven't been assessed in research.
Right, a lot of the studies are like looking more at amount of social media use, how long people are using. It's not really getting at the quality of the use. Is it that social media is worsening mental health symptoms that are already there? Or is it that social media is introducing people to new content they might not have seen otherwise that's causing mental health symptoms?
So how do we combat all this uncertainty? The actor, Stephen Graham, said in an interview that hopefully his role encourages parents to talk to their children and ask what they are seeing on their phones, what holds their interests, and be involved. Echoing similar sentiments, Dr. Gold suggests the same: open dialogue, checking in, being curious about how social media is affecting them, and also limiting screen time and building activities outside of the phone that are enjoyable. However, even with that, we are still faced with not knowing what social media can do, and because of that, parents do not have all the tools to combat it.
With social media, there's still so much that's unknown in terms of what it is, what causes what, that to, expect parents to know that themselves of, like maybe we should have done this thing or done that thing. It's so hard to do that at this point.